Hi, Miss Yan. My name is Jim. I'm a nursing practitioner student. Today, I'm going to talk about your medical problems. How can I help you?
I want to know something about my kidney problem.
Okay, first let's talk about the kidney. So, this is a picture of the kidney. So, the kidney are two bean-shaped organs about the size of your fist. So, they're located on either side of the spine, just below the rib cage. So, what your kidney do? To fill your blood to remove the waste and excessive fluid. Also control making of red blood cell and help control blood pressure. Also help control amounts of calcium, potassium, and phosphorus in the body. So what you have is chronic kidney disease, and normally we call the chronic kidney disease is CKD. And CKD is a progressive disease that advances from stage 1 to stage 5. Stage 5 CKD or end stage renal disease is commonly called renal failure. So kidney failure is when your kidney is not working. It's no longer working well enough to keep you alive. You must be on dialysis to extend the life. The progression of the chronic kidney disease is including 5 stages. During stage 1, you might not feel any symptoms and mild lost kidney function. During stage 2, you might have high blood pressure and protein in the urine and mild to moderate loss of kidney function. Stage 3, that you're gonna have anemia and early bone disease and moderate to severe loss of kidney function. Stage 4, you're gonna feel fatigue, swelling, nausea, vomiting, and there's and severe loss of kidney function. Stage 5 is kidney failure. Must be on dialysis or kidney transplant for survive. So what happens to you if you have a chronic kidney disease? Because if you have chronic kidney disease, your body the waste products. So because a lot of people cannot pee, some people can pee, but they cannot get rid of the toxin like BUN, creatinine. That's the waste products. Also cause the chemical imbalance, something like potassium, sodium, phosphorus, and calcium. And kidney failure also can lose a hormone production to help you to control blood pressure and build red blood cell and keep your bones strong.
So what's the causing for my kidney problem?
That's a good question. So normally, causing is diabetic. So especially the poor control diabetic, and also the high blood pressure is poor control as well. So and the repeated kidney infection and some immune disease of the kidney, and or heredity or some other unknown reason cause the kidney problems.
What are the signs and symptoms of the chronic kidney problem?
Normally you got itchy skin because your kidney fail, you can't get rid of phosphorus. They're gonna deposit in your skin. You're gonna feel itching, and you have a problem sleeping, and you feel nausea, maybe weight loss, and difficult breathing because of fluid in accumulated fluid in your lung. So you have a shortness breath, and you feel tired, and also you feel you have a dry skin, and because the toxin built in your body, sometimes you cannot concentrate. Okay? And people like you have a chronic kidney disease, for now, they're gonna help. So, like before 1960, people with kidney failure had a little hope for survive. But now we have a lot of options like transplant, kidney transplant, and dialysis. From the American Society of Transplantation, many patients have also received kidney transplants and are alive well for 30 for 40 years. And also, there's a lot of treatment option for you when you have a chronic kidney disease.
So what are the treatment options that I have?
Uh, Normally, you have five options. The best one is kidney transplant, and the rest of them is dialysis, and one is instant nocturnal dialysis, and one is instant hemodialysis, and one is home hemodialysis, and the other one is peritoneal dialysis. So the transplant, you have to put your name on the transplant list when you're on dialysis. So the that means you will not get it right away because your name is on the waiting list. So that's going to take a long time, and you have to do a lot of tests, and you have to wait for a donor. So, and after you get a transplant, you have to take the medication to do something under rejection because the kidney is not yours. So some immune response problems. Okay, and the dialysis, normally a lot of people that have kidney failure, they're first on the dialysis. So dialysis option, the one is instant nocturnal dialysis. So the nocturnal means night. So you go to the dialysis center at nighttime. They're gonna dialyze you for 8 hours. So most likely you're gonna sleep there, and you go there 3 times a week. So the technicians or the nurse, the nurse and technicians are gonna observe you, so keep you safe and then make sure everything is running good. And after 8 hours passed, your treatment is done. So they're gonna disconnect you from the machine. You can go to work and you can enjoy your life. That's very, the outcome is very good. Um, According to the uh, Renal Society of according from the clinical study, the nocturnal dialysis, the outcome can improve patients' quality of life and well-being because this dialysis is a long-time dialysis. It's to pull the fluid slow and remove toxins slow, so it's not big interruption in your body system. So it's really tolerable, especially for people has a lot of fluid overloaded. Okay, another one is instant hemodialysis. Basically, you go there 3 times a week, and the dialysis time is about 3 hours to 4 hours. So you have to be there on time, and the schedule is fixed. Like you go to 7 in the morning, you have to go 7 in the morning every time, 3 times a week. So because a lot of people behind you, they have the schedule, so you cannot choose the schedule. Otherwise, or you can choose your schedule, but you have to inform them early. And the instant dialysis is basically it's nurse and technicians that help you. And when you come in, the technician is going to take care of you. They connect to the machine and start dialysis, and the nurse is going to assess you, make sure your dialysis outcome is good, and then meet the requirement for dialysis. So, and the home hemodialysis is not more and more people go home hemodialysis because It's very privacy and still can keep the job, and the it's very convenient. You can do every day. You can do whenever you feel like it. It's the schedule is not fixed. So a lot of people they do the home hemodialysis, but you have to have a room, a space. You might gonna change your plumbing because the home hemo needs water, and also you need the wiring to make the machine running. So also you get 2 weeks, 2 weeks to 4 weeks of training before the home hemodialysis. So basically the home hemodialysis, the machine is smaller than the in-center machine, but it's easier to operate. But you have to cannulate yourself, or you have to connect yourself to the machine, to the machine. Some people has a fistula on the arm, forearm or upper arm. They have to put a needle by themselves, cannulate themselves. And also some people has a subclavian catheter, or they have to connect themselves. The minimum requirement, you have to have a partner to help you. So you and your partner both get trained. So just in case you need help. Also, they have a 24-hour line helpline, so you can call them anytime. You can call them. So if you need help, and the supplies they're gonna deliver to you, or when you just fill out the form, you mail to them, and they're gonna deliver the dialysis lines, and the tubings, salines, all the supplies they're gonna mail to you. Okay, and the other option is peritoneal dialysis. The peritoneal dialysis is actually use your own peritoneum to fill out the toxin. It's really natural, close to your kidney function. It's very tolerable treatment, but they have to put a catheter, like PD catheter, in your abdomen, so they can the dialysis can go into your abdomen and dwell for about 2 hours, and then after 2 hours they're gonna drain it out. So they use the same line. Of course, the fresh dialysis goes in after 2 hours dwell in your abdomen. So because during dwell time, your because the peritoneum has lot of arterial, the small capillary blood vessels, so they can exchange the toxin. So after 2 hours, so you're gonna drain the fluid out. The fluid looks like yellow, like urine. So normally you do 5 times exchange, like one fill, so it stays in your abdomen for 2 hours and drain out. This is one cycle. So normally you do 5 cycles. So there are two options for peritoneal dialysis. So because you can do the daytime, but you have to do 5 cycles. You can, like at home, you can fill, dwell, and drain it out. And if you're still working, you can go to office. You can fill and dwell, drain it out. But another option is at nighttime, before you go to sleep. It's a machine that is a peritoneal dialysis machine. So you connect to the machine. So the machine automatically do the 5 cycles. You can set up cycles that will automatically do the 5 cycles or 6 cycles for you. So you just connect it and put the dialysis on the machine. They're gonna warm the machine up and then fill it and dwell and automatically drain it out. So the next morning you wake up, you just disconnect yourself and you're like a fresh new person. You can go to work, you can do whatever, enjoy your life. That's a very good option. Okay, and about the if you're on dialysis, you have to if you're on hemodialysis, you have to pay a lot of attention about your diet, because your body cannot get rid of the potassium, so you have to watch your diet, especially the hemodialysis. So like some high potassium food, bananas, tomatoes, potatoes. So you have to sometimes you have to cut out. You cannot eat them, and also you have to watch your fluid intake. Normally, people on dialysis, they're gonna restrict the fluid intake like 1 to 2 liters per day. Some people cannot pee at all, urine at all. So that's why if you drink too much, the fluid is building your system. So especially your lungs. So you're gonna cause your shortness breath. Sometimes you just feel really, really just kind of catch your breath. It's really serious. So that's why you have to follow the diet and the fluid restriction. Okay. Also, you have to, when you're on peritoneal dialysis, you have to watch the infection. Be very careful for your infection control. The peritoneal dialysis from the study, it's a very good option, can preserve the kidney function and improve the survival time. So if you have a chronic kidney disease, the early diagnosis and treatment helps slows down the disease process. And it's important to learn about the available treatment before therapy is needed. And manage your disease will help determine the quality of your life. And you can work with your doctor to see what kind of treatment is best for you. Okay, and also you have option to accept the treatment or we can refuse it. Okay, do you have any questions?
No, I have a lot of information from you. Thank you very much.
You're welcome.